Zoom recording. And so everyone can see the screen, correct? Yes. Okay. So I've just put up here Om Danvantra Murtaye Namaha. So we're going to begin with that 7 times. It's a very simple chant. I like to keep the chants simple, especially when we're learning them. And remembering that this mantra is a mantra to ignite and empower the inner Danvantra within ourselves, the inner healer within ourselves. So it represents the healer within each and every one of us and within ourselves. So just finding a comfortable seat, sitting into the surface of what you're sitting on and feeling the sit bones, perhaps elongating the spine in any amount, feeling some spaciousness underneath the armpits and the crown of the head, reaching towards the sky. Ears over shoulders, feeling length, and just observing the breath, the rise and fall. Feel the warmth of your hands pressing together in Anjali Mudra. We'll begin with this simple mantra, and feel free to open your eyes and read it as you learn it. Exhaling completely. Inhaling. Om Danvantra Murtaye Namaha. 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 Om Shanti, Shanti, Shanti. Peace, peace, peace. And just tapping into that inner healer within. I'm going to go straight into a brief meditation, one that you can give your clients, one you can practice yourself. It includes the breath, but it also includes a mantra. It's an internal mantra, one that you say within your heart space. On the inhale, the internal mantra of so, and on the exhale, hum. Inhaling, so, exhaling, hum. So you inhale, so in the mind's eye, and exhale, hum. Inhale, and exhale. So, hum. So, hum. Following your breath on the inhale and the exhale. Sipping the air. And exhale. Your own rhythm, your own pace. So, hum. Listening to that mantra in your mind's eye. As your thoughts arise, lovingly and gently bring your awareness back to the mantra and back to the breath. So on the inhale, and hum on the exhale. Setting an intention for today's practice, today's lesson, perhaps to listen to the wisdom without judgment, perhaps to allow the wisdom to land in a place of memorization, but set an intention. Where your awareness goes, your intention goes, so does your energy. Taking a deep breath in and out. Opening today with a single inhaling. Om. Just allowing yourself to come back to the screen, the space. So hum meditation is a very simple meditation. Dr. Ladd, one of my teachers, teaches this in such a beautiful way. And I believe there's a blog on my website around how to do it with the specific steps. So if you wanted to give it to your clients or practice it for a week or so and just see how the mantra and the breath work to affect your meditation practice. A lot of times people can't concentrate or keep thoughts out of their mind. So having both the breath and the mantra is a powerful way to have people begin meditation, because people struggle with that, and so it's a very beautiful ancient meditation that includes the breath. And we're going to talk a little bit about the breath today. And I know with Helena, you ended on the prana vayu, and we're getting into the subdoshas. And we're looking at how important the Ayurvedic anatomy and physiology lens is to understanding the cellular wisdom of how Ayurveda actually gets to the root cause of disease. So knowing these foundations and knowing these basics of the doshas, the subdoshas, the dhatus and the tissues, and the shrotas and the channels in the body, you'll be able to understand how to use the therapies in a way to really get into the root cause of disease or dis-ease in the body. So that's the importance of this. It seems like a lot of language, a lot of Sanskrit at first, but you'll be using this language over and over again to where it will become second nature. So don't fear. Right now it might seem a little overwhelming as far as understanding, like, what is this idea of a subdosha? Is anyone feeling that? Like, I remember when I first started learning it, I was like, what are you talking about? I don't get this. It makes no sense. But at the end, when you have all the pieces to the puzzle, you'll be able to understand how to use the right herb for the right dosha, for the right subdosha, that's going to activate the right tissue to heal from the inside out and create the environment for the body to heal itself. So that's the importance of these doshas, the subdoshas, the dhatus, and the shrotas in the body, and especially ojas, which we'll talk about today, which is one of my favorite topics all time. So there are, and I'm just going to do a little review here, the subdoshas. So there are 5 functions of vata, 5 functions of pitta, and 5 functions of kapha, and they're called subdoshas. So they are the functions of the doshas, and the doshas are the elemental qualities in manifest form in the body, the mind, and the spirit. So these are specific aspects of each of the dosha's functions residing in the different parts of the body and performing distinct roles. And when we know these roles, then we are able to understand how the imbalance is working at a greater detail and therefore provide the right treatment for that. The beautiful thing about, and so this is where you guys ended last time, right? Was on the Pranavayu, is that correct? I went back and looked at it. So Pranavayu. So we're going to look at each one of the the Vata Vayus, and these mean movement. So Vata is all about movement in the body, and here we've got the 5 directions of these energies in the body. So prana, vyana, udana, samana, apana. And I know you did a lovely chant with Helena last week. And I want to simplify this just a little bit and say these directions help us understand what we need to do as far as the rule of opposites to bring balance back into the body. So prana is about prana coming in. Udana is about up and out. So this energy of up and out. And Vyana is about circulation all around. Samana is about absorption, is from an outwards to the inwards. And Apana is down and out and all about elimination. So these directions, I actually teach a Ayurvedic yoga course, and these directions actually dictate every aspect of movement in a yoga pose. What's grounding down, what's circulating all the way around, what's coming up and out, and what's coming in, right? And so when we think of Vata from this perspective, we understand how it affects the nervous system. We understand how it affects the mind. We understand how it affects our speech, because it really is about the movement and the nervous system in the body. So when we're going to look at each one of these subdoshas of Vata, and Vayu means wind, by the way, it means like movement. And so let's take first a look at Prana Vayu. So Prana is probably the most important primary force of all of the Apana and Prana are probably the 2 most important I would say Vayus that we look at. Prana means forward moving air or primary force. It moves from the outside in. So I'm going to teach you guys some fun things to help memorize these things today. And they're a little bit silly and a little bit primary schoolish, but they work and you'll be able to help yourself memorize them. So basically prana means forward moving air or primary force. It's the pra that means forward or primary, and it's associated with absorption. So it fills the head and is centered in the brain, and it's moving inwards towards the heart and passing through the throat. And this is what we are experiencing with the pranavayu. The dysfunction of pranavayu is addiction, misuse of senses, and the best treatment is the right receptivity and the openness to the divine. So prana is very connected with the divine. Pranayama and breathing exercises, aromatherapy, and other strengthening techniques can help balance pranavayu. The Soham meditation is because you've got that equal inhale and exhale, is a very pranavayu balancing technique that we can use to help bring balance to the pranavayu. When the pranavayu is strong, they say that no disease can affect us. Prana is such an amazing aspect. Everything has prana. If you go to the grocery store and you look at a vegetable, and you compare the vegetable, you feel what has more life force, what has more essence, what has more vitality, what has, for those of you that came to the goddess workshop, what has more Lakshmi, that energy in there. So it's a vital force. It's very important. And it's also connected closely with attraction and desire. So this is the function of prana vayu. We're going to learn more about each one of these. We're going to continue to layer on, but that gives you the overview of prana vayu. The next direction of vata, or the next location of is udana vayu. And udana vayu, you basically very closely connected to the mamsa dhatu, the muscle tissue, believe it or not. But it basically is that upward and outward movement. So anything to do with like expression, anything to do with that upward and outward energy. Udana simply means air with an upward movement or an ascending force. So or means up. At time of death, Udana Vayu, basically rises beyond the body. So, and guides the soul to subtle realms according to the willpower and karma of the spirit. So that's kind of like an interesting part of each one of these vayus. They also have a cosmic kind of realm to it as well. So when fully developed and when you've done a lot of practice, Udana Vayu grants transcendence and psychic abilities. So it's very connected to the subtle realms. Its location is the chest and the throat. So if somebody's having expression issues, then we want to take a look at the Udana Vayu. And the best treatment is spiritual aspiration and karma yoga. Karma yoga is the yoga of service, and also can be considered kirtan yoga as well. Dysfunction, abnormal expression, dry coughs, feeling like you can't express yourself, that's also a dysfunction of Udana Vayu. As we move through each one of these subdoshas for each one of the doshas themselves, start to think, okay, what would be the opposite qualities of this, and how can I bring balance to it? So if we've got an excess of too much Udana Vayu, or if it's being depressed in any way, we want to start thinking in this elemental qualities, and what are the practices that have those elemental qualities, and how can we bring them into people's lives through the practices that we are going to continue to learn throughout this program. Any questions on Udana Vayu? It even feels like it lives in the throat. Everybody say Udana. Udana. Like it actually feels like it lives there. So it's a beautiful and very important Vayu. They all are really. So the next one is Samana Vayu. And here, Samana Vayu is all about absorption. All right. So the function is absorption. It moves from the periphery to the center. So it moves from, and it's located in like the digestion and the small intestine area. This function of this is the inability or instability, such as alternating diarrhea and constipation. So even though diarrhea is a pitta issue and constipation is usually a vata issue, because it's alternating between the two, vata is at play the most there. So anytime you have any kind of alternation, like things that are moving from one dosha to the other, vata is the major cause of disharmony in the body and the mind. So we always want to look at it, treating vata, and to get that stability to ground vata, and then we can treat the pitta. So that's where, whenever you see anything in somebody's vikriti, that is going between two different types of things, or two different types of doshas or disease or symptoms, vata is at play. Gas, mental instability. So these are all functions of samana, or dysfunctions of samana vayu. The best treatment is harmonious routines. What vatas don't want the most is and struggle with the most is what they need the most, which is consistency and routine. The best way to ground Vata, the best way to support the nervous system is to let it know it is safe by having a regular routine. Any questions on that? That's nervous system 101, right? Routine. We want to do that for kids as well. So if you think about little children or even kids with autism or anything like that, having a routine is really powerful. So this idea of dinacharya, the idea that Ayurveda gives us is so ancient and so important to modern day, where we are moving at lightning pace. Vyana Vayu. So Vyana Vayu is all about circulation. Vyana means diffused or penetrating air. V means apart or separated. So it's located in the heart. Its direction is from the center to the periphery. So it's all about circulation, whereas Samana Vayu is where, is coming in the other way. Vyana is working in that is going outward from the center to the periphery. And we looked at Samanavayu, which is moving from the periphery to the center. Hence circulation versus absorption. The dysfunction here of Vyana Vayu is abnormal flow within the circulatory system, nervous system, motion, or mind. So the best treatment here is to surrender. Anybody have a hard time surrendering? I think we talked about this during one of the other sections, but to Ishvara, right? To Ishvara, going back to our philosophy module. And so that idea of to surrender to the higher power. Um, kind of a curiosity thing here with Vyana Vayu. Vyana energy easily disperses, so especially through the palms and the soles. So activities like massage, healing touch, or energy work should be performed carefully to prevent energy depletion. I have done body work for many years. I haven't practiced in a while, but when I did, I was very careful about that energy depletion. And so that's where using oil on ourselves and creating an urges protection energy can be very helpful in our Vyana Vayu, which is so connected with our nervous system and motion in the mind. So one thing which is, it says best treatment is surrender. Another thing I would put down here is doing your daily Abhyanga, your warm oil massage with sesame, coconut, or sunflower or almond oil, because that is really creating a protective energy of the Vyana Vayu. So very important there. Any questions? No? Okay. Please feel free just to raise your hand if there is a question. Apana Vayu. So Apana Vayu is all about the energy of down and out. So important to Vata. Eliminates the waste of the work that is done in the body, and its location is the large intestine. It in dysfunction there's a deficient elimination such as dryness or negativity, which is that downward energy, and the best treatment is cultivation of clarity and the upward energy. So apana simply means downward moving air or air that moves away from the body, located in the large intestine and the colon, and something that's really important is that the apana is the first thing to be considered in the treatment of vata. So I said prana is very important, but apana is the first thing that is considered in the treatment of vata. So it will also allow all the other vayus to come into balance. So if apana vayu is balanced, and we're eliminating, think about if you're constipated, how horrible you feel and how that affects your energy. And so here, if we've got the right elimination, then the rest of the body is free for that movement within the body. So since the root of most diseases lies in a vata imbalance, whether it's in the digestion system or the mind, this apana vayu is so important. And we want to take its balance into consideration when we're treating any dis-ease in the body. So that is apana vayu. So I'm going to teach you guys right now and a little way to memorize this, because it's going to be very important to understanding the location and memorizing this. So this may seem a little elementary. I want you to say it out loud. You don't have to put your speaker on, but do say it out loud. So we're going to say prana, prana, and use the hand motion so you can feel the idea of the vayu. So prana, prana coming in. Udana, udana, up and out. Udana, udana, up and out. Vyana, circulation all around, right? Samana, absorption around the belly. And apana, down and out, down and out. So usually we stand up and do this in class. So we'll do that again. So this is, and then if you could imagine yourself practicing a yoga class with this, so important, right? So prana, prana coming in. So prana, prana coming in. Udana, udana, up and out. Udana, udana, up and out. Vyana, all around, circulation, moving from the outside to the inside to the outside. Samana, samana, outwards to in. Absorption, all in the belly, right? Apana, apana, down and out. Elimination. Apana, apana, down and out. So this just allows us to visualize and feel how the vayus work in the body. When we understand the vayus and their role, then we're able to really tap into our ability to provide the right environment for the body to heal itself, or our client's body to heal itself. So as a review, prana is the direction of inward and upward. It's located in the head, the chest, the heart, and the lungs. Its movement is to draw energy inwards. It governs inhalation, sensory perception, and mental reception. Its function is intake. So breathing, swallowing, receiving impressions and information. And the imbalance is anxiety, shallow breathing, and mental restlessness. So that helps us understand pranavayu. With apanavayu, the direction is down, and I'm moving to the last one here. Apanavayu. Right here, the direction is downward and outward. So the location is the lower abdomen, the colon, the bladder, the reproductive organs. And the movement moves energy down. It governs elimination, menstruation, ejaculation, and childbirth. So all of those things are so important. And remember, it's the first thing we want to look at when treating dis-ease in the body. The function is elimination and grounding. One of the best things that we can do for apana vayu is actually an oil basti. So it's incredibly grounding, and that's where we do a like an oil enema with specific types of herbs or just sesame, because it can really ground us and create that level of nourishment if there's dryness, or it can also help us feel like revitalized when we've got that too much air and ether. Imbalance here is constipation, fear, insecurity, and reproductive issues. So that is prana and apana. Samana vayu, this one right here, remember it's all about absorption, is the direction from the periphery to the center. So it's centripetal, and the location is the navel region between prana and apana. And the movement integrates and balances, and it moves towards the digestive fire. So we might say we need, to really work with our samana vayu to help that digestive fire. Even though that digestive fire and Agni is so closely related to Pitta, it could be disrupted by our ability to absorb information, our ability to absorb nutrients, which is a Vata issue. Again, all of this will come together as we move through this. The function here is digestion, assimilation, and balance between prana and apana. Imbalance is poor digestion, indecision, and lack of clarity. So these are the Samana Vayu recap. With Udana Vayu, I love Udana Vayu. It's that upward expression. It's in the throat, the neck, and the head. It's ascending. It carries energy upwards towards expression and spiritual awakening. So the function here is speech, growth, effort, transformation, physical and spiritual transformation. Imbalances, speech issues, throat tension, exhaustion, confusion, muscular dystrophy. These are imbalances. So this is Udana Vayu, located here in the throat region. Lastly, we have Viyana Vayu, and this is circular and outward. So you can see here in the brown, the Viyana Vayu. So it's circulating all around and outward, and it's especially connected to the heart and circulation. And the movement is expansive, and it basically moves the prana through the body. So the prana comes in, and the Viyana moves that prana throughout the body. The function, coordination, movement, circulation, integration of all the other vayus. So it's how all the other vayus move around the body and nourish the tissue. And the imbalance is circulatory problems, a lack of coordination, and feeling disconnected and scattered. So these vayus, again, are such an important part of how dis-ease is distributed through the body, and how we can look at dis-ease and how we can bring the right balancing effects to bring our body back into harmony. So this is why the vayus are so important. When we're moving and we understand these movements, we can also use this idea of grounding down to rise up, grounding down to rise up, and then breathing to bring that prana in and allowing Viyana Vayu to circulate throughout the entire body. So there's an expansion. And then using our core, our Samana Vayu, to start to integrate and absorb the nourishment of that yoga pose. And for those of you that are yogis, that might make sense. For those of you who are like, okay, that seems a little weird, it is a little weird. But when you start to actually physically feel these movements and the breath in your body, then you start to understand it. So I encourage you all this week to do a yoga practice. And either go to a yoga class or go on YouTube and find a class and see if you can play with the breath and the flow of movement of the vayus in your body. So little task to do, if not this week, at least in the next few months, because I know life is so full. So that completes our overview of the Vata dosha. So what the Vata dosha subdoshas, known as the vayus and the directions. So next we have the Pitta subdoshas. Not sure why the subdosha name isn't showing up there, but that's okay. So Here, we've got again 5. So what I would be doing is flashcards and basically creating, your pitta subdoshas. On the other side have, like, what those 5 pitta subdoshas are in the Sanskrit term, and because there actually isn't a non-Sanskrit term for the subdoshas. So other than the location, which is really what it's talking about. So the function here is the digestion of food. The location is the small intestine in the lower stomach, and the imbalance. And I think that this is actually the yeah. So the imbalance is the hyperacidity, diarrhea, fever. And these are basically, this is pitta's function. Treatment is proper diet and herbs as they go directly into the digestive system. So the 5 forms of pitta are called Sadaka, Alachaka. So right here we have Sadaka, Alachaka, Brajaka, Ranjaka, and Pachaka Pitta. And these are sometimes referred as the Agnis because Pitta is closely connected to Agni. Can someone remind me what Agni means? Just call it out.
Like your digestion. So
Yep.
it's like the fire.
Correct. Yep. It's a digestive fire. And they provide and promote heat at different levels. And so pitta is what are the elements that make up pitta?
Fire and water.
Yeah. So it's mostly fire with just a little bit of water. If it was all fire, it would burn itself out. So that little bit of water is there, but it's like majority um, fire. So from here, we're going to look at each one of these and we're going to understand how the location of these. So let's just take a look at this picture really quickly. Alachakapita is in the pupils. The Sadakapita is in the brain and the mind and the emotional heart. The Brajakapita is the skin. So a lot of skin conditions are usually like especially psoriasis or anything with an itis at the end is usually a pitta issue. Ranjaka pitta, which is your liver, and then the Pachaka pitta, which is the small intestine and lower half of the stomach. So these locations all of a sudden start to help us understand how we can apply the right therapies for the pitta dysfunction in the body. So let's look first at Sadaka Pitta. Means that the fire determines what is truth or reality. So I love Sadaka Pitta because it's so much part of the head and the heart. And it means to obtain and accomplish. So it's located in the brain and the heart. Like prana, it's an inward movement. On a lower level, it includes worldly goals such as pleasure, wealth, and prestige. And on a higher level, it leads to spiritual goals and liberation. So here, it's that digestion of sensory impressions. So we often say that, we are what we receive through our senses. And it's not just what we eat, but it's what we look at through Alachakapita. It is how we can actually digest the information that's coming in. So sometimes digestive issues, and you probably experienced this, are like, if you eat when you're upset, can you digest that food properly? Do you feel good after you eat it? The answer is probably no, right? So we're better off not eating if we're in an upset state because we're not able to actually digest it. And this is one of the reasons why in Ayurveda we say to eat in a calm environment, to make sure that we're preparing the body for digestion, because then the digestive system can do its function and not be you know trying to do other things that are, that overtake the emotional heart and head. The imbalance here is nerve inflammation, headaches, and heart disease. The treatment is 5 sense therapies, such as Panchakarma, included in Panchakarma, and then also looking at each one of the sensories and bringing the opposite therapies that bring balance and cooling, mental rest, and Jnana yoga. Jnana yoga, can anyone remember what that is? The yoga of knowledge, right? Jnana means knowledge. So here, so this is Saddaka Pitta. The next one is Alachaka Pitta. I hope I'm not moving too fast, but I want to get through these and so that we can then see how these subdoshas work. So Alachaka Pitta is the function of digestion, of visual impressions, pupil of the eye, bloodshot eyes is the imbalance in the excess, distorted vision. Treatment is the right use of eyes and self-honesty. So there's a term in Ayurveda called Tejas. Tejas, Ojas, Prana Tejas and Ojas, the subtle qualities. And Tejas is very closely related to Pitta. Tejas is that inner fire. So have you ever met someone who has a brightness in their eyes that like seems to sparkle, like they've got this vibrancy and through their eyes? And that's that balance, that self-honesty, that right use of senses that is coming up and out through that inner glow, that tejas, and that is part of Alachaka Pitta. I'm hitting my computer right now. So this is a very important subdosha, and it governs our visual perceptions, and it's our internal combustions, the release of energy from our life impressions and experiences, like I said, with the Tejas. It's empowering, often cultivated through empowering the mind and directing our intelligence inward. So doing those internal practices where we bring that internal practice into our inner heart, like Udana Vayu. So there's a close connection here. It has an ascending movement and leads us to seek light, clarity, and understanding. So through the eyes, we assess the condition of the liver in the body. So we know that if there's yellow eyes, we've got a liver issue, or any kind of jaundice or anything like that shows up in the white of the eyes. So the liver is closely connected to the Alachakapata, Pitta, and then the clarity of gaze reflects good digestive power and deep intelligence. So I don't know if you ever met someone, they just have a powerful gaze, and that deep intelligence is known as sattva, and sattva is that very like white and clear and clean living and way of being. I see there's a question here. I'm just going to look here. So what about surfing and bloodshot eyes? So too much salt. Are you talking about too much salt? Yeah, yeah. I mean, that's just too much salt. Bloodshot eyes is definitely, that's just the irritation of the salts from surfing. Now, if you've got bloodshot eyes from an itis, that's another thing. Like, or then there's some inflammation. But usually, that's just too much salt, which is too much acidic. Yeah. So keep surfing. Keep surfing. That's just that part of surfing, isn't it? So Pachaka Pitta. So Alachaka Pitta is beautiful, and start to one of my favorite practices for Alachaka Pitta is eye gazing, and where or we can also use a candle, and Tatrika, I think it's called, and basically you direct your gaze on a single point. We'll do this in our sensory therapy module, and this can be a really beautiful way, either eye gazing to cultivate this idea of tejas, or to cultivate our awareness of our eyes and our self-honesty, and to have that direction inwards. So we want to increase our direction inwards. One of my master teachers would say, to be a mystic, you live 2/3 within and 1/3 without, which means most of your life is lived in your inner world, in that sense of meditation, personal practice, personal knowledge, um, that wisdom within, and then you live 1/3 externally, in life. And I don't know what that means, but I do know what that means. But it's like we're not walking around as mystics anymore, but he did. He did. All right. So Pachakapita function and this is one of the very important pitta uh, subdoshas that we use to understand our digestion. So this is all about digestion of food. And as you know, in Ayurveda, digestion, sleep, and right relationships. So some of our 3 pillars of life. And so here, the location is a small intestine and lower stomach. The imbalance or excess is hyperacidity, diarrhea, fever. Treatment is proper diet and herbs, as they go directly to the digestive system. The beautiful thing about the digestive system is we can quite often catch disease before it relocates, manifests, and diversifies into a, uh, a Western named condition. So if we're listening to the hyperacidity, if we're listening to the diarrhea, if we're listening to the fever in the body, and we apply the right herbs, the proper diet, the balancing qualities, then we can stop it from relocating, manifesting, and diversifying into a formal disease yeah. So when the body whispers through these, dryness, through skin conditions, through gas, through constipation, through diarrhea, through alternating constipation and diarrhea, through, and when our mind tells us, that there's an imbalance, if we're listening to these whispers of the body, which are not really whispers, are they? But we've so learned to be like, oh, I've just got a little bit of gas, so what? But as we learn Ayurveda at a deeper level, we learn to listen to those small imbalances as large screams to what we need to do to bring balance into the body so it doesn't relocate, manifest, and diversify into something that is outside of the digestive tract, and deeper into the deeper tissues of the body. And that's why we're learning this, because if we can stay within these, listening to the whispers of the body, if we can hear our clients tell us, we can hear ourselves and our bodies telling us, oh, you know what, I've got hyperacidity, I've got acid reflux, I've got it's not something to ignore, it's actually something to listen to. Or if you get cracked lips, or whatever the dryness is, like all of these very loud screams from the body saying something's out of balance. And all you have to do is apply the opposite elemental qualities and the sensory therapies to bring it back into balance before it becomes a bigger disease. It is that simple. We don't have to overcomplicate this. And so as we move forward, keep remembering that, because 9 times out of 10, through the digestive system and the mind, we can support the body's environment to heal itself before it becomes a greater problem. And that's what, as a consultant, you'll be working with. As a practitioner, you'll work on the disease level, where it already has relocated, manifested, and diversified. But as a consultant, you're working here of the preventative lifestyle choices and decisions and dinacharyas, and herbal remedies that you can apply. So this is the foundation of becoming a practitioner, these subdoshas. Brajakapita is about touch, digestion of touch, sunlight, and oils, and skin luster. It's all about the skin. And so here, red rashes, skin cancer, inflammation on the skin, is very, tells us, okay, Brajakapita has an excess or an imbalance. Let's take a look at what's going on. Often these rashes and things are caused by, too much heat in the body, or it may be too much dryness in the body. So we do have to look at Vata and Kapha as well. Very important, and you'll learn how to do that over time. The treatment is the right use of touch and avoiding extreme heat. When we think about the sensory therapies, we want to think, okay, what kind of touch is needed? Is it firm touch? Is it light touch? Is it medium touch? And as we learn about each one of the doshas, we'll learn what is needed. Kapha needs a stronger touch to stimulate. Pitta needs a medium touch or some softness, and Vata needs slow, right? So they're all the opposite of the qualities of those specific doshas. So we'll look at that when we look at sensory therapies. Brajaka Pitta means the fire that governs the skin's brightness and texture. We can observe the body temperature, the heat distribution, and the radiance of our aura. Like Vyana Vayu, Pitta is involved in circulation and has a centrifugal energy. So it helps distribute heat throughout the body. And excess Brajaka Pitta leads to excessive sweating. So it's also closely related to our sweat organs being in the skin. And so here we're looking at those imbalances as well. Pitta can be smelly. So we know if there's a smell related to the disease, to the sweat, then like if there is a strong odor to sweat, we know Brajaka Pitta is at play here. Pitta overall is at play because Kapha is a sweet smelling, Pitta is a lot of sweat and smelly, and Vata is less sweat. So this is just something to take into consideration when you are looking at all your diagnostic tools. How one sweats tells a lot about what's going on in the body, and what it smells like tells a lot about what is going on in the body. In our diagnostics, we actually do a urine test where we drop sesame oil into your urine, and you notice how the sesame oil forms as either a platelet or a snail trail, or and you'll learn how to do a urine drop test, and it's interesting how each one of the doshas show up there. But you also smell the urine, and there's a lot of things that come into play with that. But we'll talk about that, and that's also connected closely to the Pitta. Ranjaka Pitta function is formation of blood, provides color to the body. The location is the liver, the spleen. The imbalance here, or the excess, is any kind of discoloration. So red, yellow, green, liver and gallbladder disease. These are definitely part of Ranjaka Pitta. So Ranjaka always has to do with the liver, the blood, and the spleen. Proper use of all the senses and proper management of energy and intensity. So the liver is closely related to anger, and it's closely related to how intense one is. So if you've got this Pitta energy, then the intensity in your liver has a little bit more fire in it. Not only does our digestion have Agni and fire, but so our liver can be if our liver's hot, then we can have quite a bit of anger that is related to this. So also, if you find that there is no color in if you're very white, then it's also telling us that there's some form of construction with the liver, the blood, and the spleen, because we're not getting that beautiful color and tejas to our body. Ranjaka Pitta has a downward moving energy, but that's not as important as really understanding it's closely connected to the liver, the blood, and the spleen. So this completes the Pitta, the 5 Pitta subdoshas. And like I said, I highly recommend doing your little cards and having the location, the imbalance of treatment for each one of these. So to review, Alajaka Pitta located in the pupil, Brajaka Pitta, the skin, Ranjaka, the liver, Sadaka, the brain and the emotional heart, and Pachaka Pitta, the small intestine and the lower stomach. So these are the Pitta subdoshas. Moving to the kapha subdoshas, and here we're looking at Bodhaka kapha, Tapaka kapha, Avalambaka kapha, Kledaka kapha, and Sleshaka kapha. Each of these have locations as well. Kapha itself lubricates the stomach, and the location is the stomach, especially the upper. The imbalance is sluggish digestion and nausea. The treatment is proper diet and herbs as they go directly to the digestive system again. So Badaka Kapha is the mouth and the tongue. Tapaka is the brain and the emotional heart. Avalambaka Kapha is the chest and the lungs. So any kind of mucus that sits on the lungs. Kapha is so related to that sluggish digestion, weight gain, it's mucus. It's that, remember, if you can, it's that time of life of the baby, like it's those, younger years where they're snotty and there's mucus, and it's like, and it's also the beginning. It's the darkness. Um, it's that where everything comes from. So it's kapha is needed for the construction and the the gross, when I say gross, but I mean like the bones and the structure of the body. So it's such an important dosha for life. Kladaka kapha is located in the stomach, and Sleshaka kapha is in the joints. So let's take a look at each one of these. Tapaka kapha is basically about lubricating the brains and the nervous system. So its location is the nerves and the heart. If there is an imbalance or an excess of Tapaka kapha, it's sluggish, dull nervous system and the mind. And the treatment is the proper use of all the senses and to avoid excess sleep. For kapha, we really try not to have naps and wake up before 6 a.m. because we want to wake up in that vata time. Kapha people tend to struggle with, or imbalances tend to struggle with waking up early. Pitta people will jump out of bed, vata people will be varied, and kapha has that harder time waking up. So here we want to really avoid too much sleep and do more stimulating things through the senses. Tapaka kapha means a form of water that promotes contentment. And like prana, it has an inward movement that helps experience happiness within our own essence. So meditation can stimulate its secretion, transforming it into that soma or amrit, that magical elixir of life, or the nectar of immortality. So Tapaka kapha is very important for what I would say lubricating the brain and the nervous system that gives us that feeling of bliss, even if you'd like to say it that way. So this is Tapaka kapha. The next one is Bodhaka kapha. We'll get to the end of these and then we'll also take a break. But Bodhaka kapha is all about the mouth, the tongue, the throat. It lubricates the mouth, the tongue, and the throat. Excess can be too much saliva and mucus, and the treatment again is diet and herbs. So with Bodhaka kapha, it enables perception, and it's allows us to taste our food. So whatever COVID was, where we lost our sense of taste, there definitely was. Did everybody have a form of COVID? I'm not sure if you did, but you definitely lost your sense of taste. So we would say that the COVID virus impacted our Bodhidharma kapha because we were not able to taste. And like Cladaka kapha, which we'll see next, it also plays a role in the first stage of digestion. So our tasting our food, smelling our food, tasting our food, first two steps of digestion. Um, and so like Udana, Vayu, Bodhaka Kappa has an ascending action and grants knowledge. So similar to Alachaka Pitta, it resides in the head and facilitates perception. So as we evolve, it governs our sense of pleasure and refinement in pursuit of more subtle forms of enjoyment. So this is such like tasting life, the juiciness of life. It's all about like if we cut something out that is, it brings us enjoyment. And we obviously everything in moderation, but we want to taste and have that joie de vivre. And so Bodhaka Kappa has a lot to do with that sense of subtle form of enjoyment. Um, Ayurveda can really be a pathway to tantric living. And what I mean by that, and it's got nothing to do with sex, but what I mean by that is that we get to fully experience life through the senses in a way that we understand how it affects us. Most people don't have this wisdom, right? So part of our job is to share this wisdom of how Ayurveda works at the sensory level, but also at a cellular level. How powerful is this when we understand that through taste, through, you'll learn in the nutrition module that there are 6 different tastes, and each of those tastes relate to each one of the emotion, each emotion. So this is very, very powerful. So we'll look at this in more detail later. Kleinaka kappa, the function here is to lubricate the stomach, and especially the upper stomach. It's located there. An excess and an imbalance of this is sluggish digestion, nausea. The treatment is proper diet and herbs as they go directly again to the digestive system. So this, as you understand, like now, when we look at diet and herbs, how much balance we can bring into our world just simply by using diet and herbs. And herbs can be tea. It could be a licorice tea. It could be a peppermint tea. There's lots of different ways that we can bring herbs and the right foods into our diet. So Cladaka kappa means a form of water that moistens. It's located in the stomach as alkaline secretions that line the stomach and the entire digestive tract. Like Samana Vayu, which is all about absorption, Cladaka kappa has a balancing function and serves as a mediator between the digestive system and the internal tissues, regulating the moisture levels in digestion. It also works closely with Pachaka pitta to protect the mucosal lining of the digestive system for Pachaka pitta, or our Agni, and our digestive fire. So it's a delicate balance to make sure we have enough moisture, enough lubrication, enough fire, enough cooling. This is where we start to really understand how kapha can be such an important part to overall health, as well as pitta, as well as vata, and how they all work together to bring this unique balance within the body. But again, understanding that each one of us and each one of our clients are completely different. We have different constitutions, we have different makeups, and we have different nadanas. Nadanas mean things that we do that perhaps bring us out of balance, that we need to work with. So understanding someone's constitution, understanding their Vikriti, their Prakriti, their Vikriti, and then also understanding their nadanas of the daily practices that bring them out of balance. And then from there, tweaking that and giving them the proper sensory therapies, diets, and herbs to bring them back into balance. It's that simple, and you'll learn how to do it, I promise, for yourself and for others. So lastly, or no, second lastly, we have Slayshaka Kappa. It lubricates the joints. And an imbalance of this is again like that color, like if there's any kind of discoloration, proper use of this, all the senses, stretching and exercise. So making sure that that synovial fluid really moves. That's so why movement is such an important part of and why Harmony I want to put movement as the, you know, the fourth pillar, because it's such an important part. We're learning more and more about our uh the kind of like how our joints work and how our fascia, so the fascia in our body actually is the communication process from which all of the wisdom is passed through. So fascia is like the tensegrity that holds us all together. If we were to take all the bones out, our fascia would actually be the same shape of what we are, because it has this level of tensegrity. But through that, it is the this information channel that that basically all of the communication between the cells, the mind, the body, the spirit happen. So for a long time, we've really discounted and not really understood the importance of fascia. Like when we cut into fascia, and then we have surgeries and there's scar tissue there, we actually create uh, information like clog, which is why like we have the scars, right? Like that fascia can't get through and can't communicate, so it has to find new pathways to communicate. So that's why we're actually learning how surgeries can be so impactful on our body's overall sense of health. So this has a lot to do with Slayshaka Kappa and its ability to communicate, and it's often commonly associated with arthritic problems, even though arthritis is often a pitta, because it's like an itis, arthritis, is a pitta issue. Often it's closely connected to Slayshaka Kappa as well. So moving forward to Avalambaka Kappa, here the function is to lubricate the lungs and the chest, the heart and the lungs, and its location is the heart and the lungs. When we have a respiratory infection or any kind of respiratory condition, any kind of clinging, weight gain, wetness, moisture, that is indication of Avalambaka Kappa. And it's often connected to attachment. So sometimes weight gain can be often weight gain can be an emotional issue connected to attachment or fear of losing something, which is attachment, another definition of attachment. And it is located, like I said, in the heart and lungs, and it corresponds to the body's basic plasma, or rasa. So rasa we're going to learn about in a minute, and it's a primary aqueous constituent, which is distributed through the heart and the lungs, from which all kapha and its substituents are produced. So rasa, like we will talk a lot about rasa and how nourishing our rasa creates overall health and ojas in the body. So if we don't have a nourished rasa, then our blood and all the other systems in our body struggle. So we'll look at rasa. It's rasa, rakta, mums, it's the first tissue that all of the nutrients go to when we are developing our cells as they develop on a daily basis. So rasa becomes a very important aspect of Ayurveda, and one that I don't think modern medicine often takes into consideration enough. And so we'll look at how we can support people's health through through plasma, through rasa, and when we understand how what we intake in and how rasa is the beginning of the process of our cellular production, then we realize that high prana food and sattvic intake can affect the rasa all the way down to the last dhatu or tissue, which is shukra, which is our reproductive tissue. Like it all begins. There's this line of beginning, middle, and end of producing our cells, right, to producing another human. So we're now looking and starting to look at this primary fluid, as which is rasa, our plasma, as how it creates our glow, our cellular everything. So just like apana, which is vata vayu, like the down and out action, it makes us feel stable and full in the chest and the heart region. However, in excess, it can also make us feel heavy and overly attached. So most possessive emotions can increase if we have too much of this. And then any kind of lung disease, congestion, swollen glands, Avalambanka kapha is what we want to look at for treatment. And its imbalance is responsible for most mucus in the body. So clearing and eliminating the mucus from the chest is the basis for removing most excess kapha from the body. Even if water retention is present, we want to look at the mucus level in the body. And we'll learn how to do that throughout this process. So that is the overview of the kapha subdoshas. And again, we've got Bodhaka kapha, the mouth and the tongue. We've got Slesha kapha, which is our joints. Tapaka kapha, which is the brain and the emotional heart. Avalambaka kapha, which is the chest, the heart, and the lungs. And Kledaka kapha, which is the stomach. So these are the subdoshas. Any questions? I've talked a lot. I'd love to see if there are any questions on any three of these subdoshas. Any clarity I can bring to that. Yes, Donna.
Amazing, thank you.
You're welcome.
This is me. I'm speaking about me.
Yep.
I'm predominantly this is with working with Harmony. I'm predominantly Pitta Vata at the moment, or Vata, but I have a lot of kapha issues going on there. But I have a rash on both of my shins that I cannot get rid of. I'm not a rashy person. It all started with too much fly bites. I don't normally get bitten by anything either. And it has really flared up since I had my ankle injury come surgery all back in June.
Interesting. Yes.
Um,
So, is your rash red, or is it
it is.
dry? It is
It's
red.
red, it is raised. You can look at it and think, oh, that's psoriasis. But then you look at the other leg and you think, oh, is it lymphatic drainage? Yeah, I'm supposed to be seeing a dermatologist on Monday and talking about losing attachments, blah, blah, blah. I have issues with going to the specialist. I don't want to go. I didn't want to see a doctor about this. So I am wondering if that's all a part of what's going on too. Yeah, I just, it's just quite a puzzle. And yeah, I'm really keen for some input.
Yeah. So, without seeing like your full chart or anything like that,
Yeah,
I can't like do like the full thing. But what I would do is
exactly.
take a look at each one of these subdoshas, right?
Yeah,
Take a look at the rash. You said
yeah,
manifested after we cut into the slasha, like the joints of the kappa, um and and I've also asked about your digestion right now, which I won't
yes.
I won't do here, but
Yeah.
I'd look at your digestion. Your digestion will also point you in the direction of what is most out of balance right now. So how is your elimination?
Mhm.
And take a look at that. And then allow yourself to look at which dosha you think is, and this is showing up here. So the three most important subdoshas, and I'm not avoiding your question, are Apana Vayu, so Pachaka Pitta and Kledaka Kapha,
Okay.
right? This is all about digestion. And Apana is down and out, is that elimination. Pachaka is that Agni, and Kledaka Kapha is about protecting that digestion. So look at those three first, and then see, because I would, you think psoriasis is pitta, but it may actually be, and you said you've got a lot of kapha imbalance right now. So
Yeah.
yeah,
Yeah.
so it's probably a pit, what my like overall would be, it's a pitta kapha imbalance right now.
Yeah.
But we want to work with the apana vayu to make sure that your elimination is correct.
I had intravenous antibiotics very reluctantly with my surgery, and
Yeah.
I know from live bloods my gut is messy.
Yeah.
Yeah. Mm.
So I would start there with probiotics, and then also Trufala, and then
Trufala. What's trufala?
Trufala. Trufala is Amalaki, Haritaki, and Bibitaki. It's three fruits. It's a very traditional formulation. It helps the rasa, so that rasa fluid that I was talking to you about,
Yep.
but it is also a colon tonifier, so it will help um, tonify the colon.
Where would I get that from?
You can get it from the health food shop. They sell it.
Okay.
Yeah.
How do I spell it?
TRI.
Yep.
I'll write it up here for you guys.
Thank you.
Um, TRIPHALA.
Great.
Without having more information, that would be where I would start. And
Yep.
hopefully
That
this
sounds great.
this
Mm.
example, guys, shows you like the importance of just really looking at the subdosha, the locations,
Yeah.
and going from there.
Yeah. I really
Again, not
appreciate
having
your
like the
time.
full,
Thank you.
yeah, that's all right. Not having that full like I said, history and everything. I probably
Yeah. Yeah. No, you've nailed
say
it.
too
You've nailed
much,
it.
but
Just, yeah,
yeah, then just take a look at those things.
that's great. I will.
Anybody else have a question? Yes, Danny.
I just have a really quick question in regards to tripla. I know you cannot take it when you're pregnant. Do they still recommend not to take it when you're breastfeeding?
So, how many months have you breastfed for?
She's 6 months old now.
Yeah, I think it would be safe at this point.
Yeah.
But just don't take too much of it.
Yeah.
It can only help. They're just precautionary. Like, can
Yeah.
actually probably help your the baby as well. So, yes,
Yeah. Yeah.
yeah,
I just feel like now's the right time intuitively. And I thought, oh, I might just check in with you just to
yeah.
see. But yeah, thank you for that.
At 6 months, I think you're fine. Any time before that, I would just be more cautious. But she or he,
She.
she, yeah. Yeah. What's her name?
Ellie.
Ellie. I have an Ella.
Yeah.
Yeah. So
So
I think
do I.
you're
You're
lovely.
awesome.
Any other questions? No? Perfect. All right. So, do you guys want to take a break for 5 minutes and grab a tea and go to the bathroom and then come back? Yeah. Okay. We'll take a 5-minute break. I'm just going to stop recording so we don't have a big, oh, I'll leave it actually in case people want to take a break if they're listening.
Are you there, Jasmine?
I am. Can you hear me?
Yeah. Um, when we come back, can I ask a question just about um the last slide that you had up before, the three most important doshes?
Yeah, absolutely.
So,
You can ask now if you like.
oh, okay, cool. So I was just looking over it, and I just want to see if how I'm interpreting it is correct. So, the, like, why they would be so important, obviously, is like kapha protects the digestive. So if the digestive tissues are protected and lubricated in the right way, then that facilitates what's needed for the strength of the Agni and digestion to ensure that that process is efficient and proper. And then obviously if that's right, then the apana vayu for eliminating the waste and the toxins out of the body, if that's in the proper expression or right way of doing it, that then is why Ayurveda says you are what you digest.
Correct. Yeah. It's
Okay.
also, they're also the home sites of each. So like the subdoshas have a home site. So
Okay.
each of these are a home site, but obviously they're quite connected to digestion. So they're located in the digestion system, and these are the home sites of each of the doshas, and they are treated anytime there is a doshic disturbance, regardless of the other subdoshas involved, because of
Yeah.
the reason you just explained. That's exactly right.
Okay.
And we just take them into consideration. And because like if we don't look at the elimination, and you saw me do this with Donna, I was like, tell me, like, let's look at your elimination. I mean, we're talking about her skin. So
Yeah.
like, you know what I'm saying? Like that we always go there because it will always point to and give us information we need most of the time, not always. Like I'd say 90% of the time through the elimination, we can tell what's going on with the body. And so that's that piece. And then also through the strength of digestion. So if we can't get enough information from the elimination, well, how are you digesting your food?
Mm.
Because in Ayurveda we say it's not just what you eat, it's how you digest it. You can have one person eat McDonald's every day and have perfect digestion. Um, I don't think that would actually happen, but some people have more agni and the more ability to digest certain like toxins than others. So we've really got to
Mm.
look at the strength of the digestion of each individual so that we understand that aspect.
Mm.
And then if because the digestive fire is so hot and like the agni is there, if we don't have enough mucus, that's where it dries out, and there's not enough ability, and that's where vata can be created, because it's actually a kapha imbalance, and then there's a vata kapha imbalance, which can be quite dangerous. So
Mm.
you definitely need that that kapha to support the moisture and bringing more water and earth. And in quite simple terms, this is all about the elements, right?
Yeah.
So you've got air and ether, you've got fire, a little bit of water, and then you've got um your earth and water in the kapha. And so it's that intimate relationship between the balance of all of those three in order to have balance in the body. And that's what
Yeah.
always we go back to. If in doubt, go back to the elements. They will point you in the right direction, and they'll tell you, oh, there's too much air and ether, so I need to have more water and earth. There's too much fire, so I need to cool it down with more water and earth. So you're in constant communication and you're basically living the elements. I think Ayurveda could, the second name could be living the elements, so that's how you can look at this in an elemental way as well.
Okay, cool. Thank you. I'm just really trying to work with myself on this. So, and I want to like understand it myself in a very deep way so that I can then show my son how to do it as well. Because we talk about the elimination a lot and we look like we're interested in it.
Yes.
And we talk about, okay, well, like when you look at that, what do you think you need? And sometimes he's like, I need more water, and but like I can only sort of go that far, and I'm still trying to figure my own stuff out. So I just was trying to see, piece together like what if like obviously start with the Apana Vayu, and
when we get to the diagnostic
there.
portion too, you'll have more information because you will ask things, are there food particles in your feces? Are there is there mucus in your stool? So if there's mucus in your stool, then there's a kapha imbalance. If there's like food particles in your stool, then your body's not digesting the food. Like if you see corn, or if you see like the actual food not fully digested, then we're looking at an Agni issue, or if you've got constipation and dryness, then you've got a Vata issue. So and diarrhea is obviously a Pitta issue, but mucus in your stool is a kapha issue. So we'll be able to, you'll be journaling about your own stool. Don't worry, you don't have to share it. But like you'll be able to really start to understand what that means and feel comfortable talking about it, because in Ayurveda we probably talk about all of the taboo topics. We put oil in orifice, we talk about poop, we talk about sex, we talk about sleep and relationships and all of the things that are usually taboo to talk about, but they're the most important things that we need to talk about. So you'll get really comfortable with that. Good question.
Awesome.
Thank you. So now we're moving on to, and we have 22 minutes. So we'll get through these dhatus. And dhatus simply mean the layers, or like the 7 tissues of the body, which, da meaning support. And this concept actually parallels with the universe as a whole, which also has 7 planes of existence. We've got the 7 chakras. 7 is a magical number. So the dhatus are formed from digestive food, right? So, and their waste products are eliminated through feces and urine. So Danny, really great. Like here we go. We're talking about what is actually happening here. And well, the doshas are the causal factors of diseases. The tissues are the sites where the diseases occur. And remember, I was talking about the digestive tract is so much easier to treat than if the disease relocates, manifests, and diversifies into one of these tissues. Then it becomes a modern medicine, like pathological, like pathology. And so here we are going to look at each one of these. And I was talking about rasa earlier with Sleshaka Kapha. And so we've got rasa, rakta, mamsa, medis, asti, maja, shukra. Let's say this together, okay? Actually say it out loud. Actually, everyone take yourself off mute. We'll do it together. We'll get the energy going here. So ready? Rasa, rasa,
Rasa,
rakta, rakta.
Rakta,
Yep. Mamsa,
Mamsa,
medis,
Medis,
asti,
Asti,
maja,
Maja,
shukra.
Shukra.
Okay, so we'll put it together. Rasa, rakta, mamsa, medis, asti, maja, shukra. Let's do it again. Okay. Rasa, rakta,
Rakta,
mamsa,
Medis,
asti,
Asti,
maja,
Maja, Shukra.
We'll do it one more time. Ready? Rasa,
Rasa,
Rakta,
Rakta,
Mansa,
Mansa, Meda, Asti, Imaja,
Maja,
Shukra.
chakra.
All right, awesome.
Shukra.
Shukra. So each one of these forms a concentric circle from the grossest to the subtlest and move through the body. So rasa is, like I said, that initial fluid. It's the plasma of the body. Then we go to rakta, which is the blood. It's the hemoglobin and the platelets. Then, and I'm trying to like show you here, this, I think Helena must have done these slides because these are in Spanish or Portuguese. The rakta is the hemoglobin and platelets, and then the mamsa is your muscular tissue. And then the meatus is your fat tissue or the adipose tissue, meatus. Bones is the asti. So this is anything to do with the bones, and then the maja is the bone marrow and the nervous tissue, very important. And then we've got shukra, which is the reproductive tissue and the male and the female. So it's like the sperm, and it's what creates life. So if you can start to understand that everything we absorb, not just through our diet and the digestion of food, but through our senses, makes up our cells. Where we have all these tissues and all of this. So we have this amazing like understanding, and there's when we go deeper into this, you'll see that it takes, I think there's a couple of different, either 39 days or 41 days. There's a couple of different concepts of that shukra tissue to be created. And so if we can think about everything we input through our senses, including our food, including our herbal herbs, medication, anything that we absorb into our system becomes our life force energy, becomes our ojas, becomes our ability to withstand stress. So the higher quality of sensory input, including food, including our thoughts, that we have, the higher level of ojas we're going to have in our body. So this is our relationship to how we play our role personally in our own well-being. Can you see it? For me, this is like part of the magic. Like I look at this and I'm like, okay, if I have a choice here of what I'm going to put into my body and how I'm going to function in the world, and to know that that choice impacts every one of the tissues that operate in my being, in my physical being, not even to mention my spiritual being, then this is my sole reason for making the right choices. So any questions on this? Because it's a big and very important topic. And does anybody have anything they'd like to add? No? Okay. So rasa is the plasma and lymph. It's produced from digested food by the action of its specific digestive fire, or the rasa agni. So from the plasma, the other tissues are produced depending on it for nourishment. All right. So rasa is, remember how I was saying rasa is so important. So from the plasma, the other tissues are produced depending on their nourishment. So the Ayurvedic perspective sees plasma as the ocean of nutrients, while the other tissues are like the islands nourished by the oceans. I'll say that again, while the other tissues are like the islands nourished by that. Okay, so each tissue is nourished by a more subtle byproduct of the previous tissue. This is why rasa is so important. Okay. And this is also where we get ama from. So we've talked about, and if you haven't heard it yet, you'll hear about it again, this idea of ama, which is the result of undigested food that becomes toxic in the digestive system. And so if you understand this concept, this is how the importance of how having less armor in the body allows our rasa to be more nourishing and less toxic so that our ojas is high. And so just keep that concept in mind as we move through this program, because that's what you'll be working on so much with your clients, because most foods in modern day world are sweet, sour, or salty, and they increase armor and our body's ability to be able to keep our Agni high and digest food at a level where we actually get the nourishment so that these other islands can be nourished. And then that's where we get the depletion from, and why our overall nourishment is so important. So again, each tissue is nourished by a more subtle byproduct of the previous tissue, just like a milk produces cream, which then turns into butter, eventually ghee. I don't know if you guys have made ghee, but I'll do a ghee making class at some time. It's one of my favorite things to do on a full moon. I'll have you guys over and we'll do it. And so you know, it's that pure ghee is that purified butter. There's actually no lactate. There's no in at the end of ghee, there's no milk fat in there whatsoever. It's just pure. And it has a high burn point, and it's so good for you. And it's really good, which is really interesting. It's really good for Alachaka Pitta. So it's really good for the eyes. So ghee has a prabhav, and what I mean by prabhav is a Sanskrit term for a liking to. It's helpful for a prabhav for eye conditions. So I think she's gone, but you know, after surfing, you can put some ghee in your eyes, and probably she'll tell Emma that when she gets back on. So that ghee it has a prabal, because it's and the eye tissue is so closely connected to the nervous tissue, so it's a pretty neat correlation there. So we've got this idea of this purified ghee, or this purified end product, being the shukra and the ojas. Each is produced through the digestion of the previous one, so that the lower tissue becomes the food for the above one. And this is what we have to remember, and why the quality is so important. So each tissue is formed by a coarser one and produces a more refined one. Plasma, when it's digested, transforms into blood. Blood transforms into muscles. Muscles transform into fat. Fat into bones, into marrow, into the nervous system, and into the reproductive fluid. Thus, in reality, there is only one tissue in the human body that undergoes 7 levels of transformation or metamorphosis, and that is your shukra, and that's what creates life. Tell me that isn't magic, right? And that understanding in itself, right? Like if you think, oh, like we think how. That's why even the seed of a food is so important, because that seed, and if we understand that element, and like the herb, the plant, and our symbiotic relationship with plants becomes our rasa, which becomes us. So I've got goosebumps when I'm saying that. And like when you like understand this process, you understand how we are nature. We are nature. That reproductive fluid that creates a human being is the transformation of the food that we put into our mouth. But we also have to understand that our food is impacted by all of the other senses as well. That's why praying over our food, taking a moment of gratitude, really caring about where our food comes from. And if we can't do that, the intention of like putting an intention into the food prior to eating it can be so powerful. So you know, this right here, the dhatus are the magic of life. Our tissues, our cellular, like every 7 years we have a complete new set of tissues in our body. And so we're constantly renewing ourselves. And we can do, and if we know that, that's why we do these 21-day cleanses, because we're basically refining this process through Panchakarma, so that we get to that, to the end product. Have you ever eaten really clean for a month or two and felt amazing? This is why. This is why. And then you introduce junk again and you don't feel as good anymore, but it sometimes takes a few weeks for that to actually take into effect. That is why. So here we have this idea of the dhatus, and next week we will start to go into each one of the dhatus in detail. I'm not going to start that this week, but just so you know, I'm just going to move this because it's on my way. The tissues and the doshas. So kapha, water, is responsible for all tissues in the general, and particularly the 5 of the 7 tissues, as it forms the basic substance of the body. So kapha is such an important part of this. This includes the plasma, the muscle, the fat, the nervous tissue, and the reproductive fluid. This is why we say kapha is the structure of the human body. Pitta and Vata serve to create one tissue. Pitta, fire, creates blood, and Vata, air, creates the bones. So anytime we have anything to do with the Asti Dhatu, which is the bones, Vata is like brittle bones, osteoporosis. This is a Vata condition, and has a lot to do with air, and the formation of the bones themselves. So all 3 doshas are responsible for the formation of tissues, where kapha is the structure of a lot of the tissues. And you can see how there is the relationship between the tissues and the 3 doshas. So there's also a relationship between the tissues and the elements, and plasma is related to water because it is rasa. Rasa is that there. Blood is rakta, it's fire and a little bit of water. Muscle is the mamsa, and that's earth. It's secondary fire and water. Fat tissue is metis, and it's water. It's subtler than the plasma. So the metis has a lot of water, and you can think about edema and how there's that water element there. Bone tissue is earth and air, which is vata, right? So there's the asti, then that is the connection to vata. Bone marrow nervous system is maja, it's water. It's the subtlest form of water and a little bit of earth, which the nervous system is so subtle. When we talk about the different nadis in the body, which we will talk about, will really tap into the nervous system and that maja, and understanding how subtle our nervous system really is. You can think about the nervous system as a physical system, but then there's that's energy. So then there's the energetic system, and it's really just the aura of the nervous system. So that's how subtle it is. Then the reproductive tissue, the shukra, and this is water, and it's essential causal form of water. And we see that in ejaculation, and sperm being able to swim into where it needs to go. So this all leads to this idea of ojas, and I'm going to end today on ojas because it's so powerful and allow you to like kind of sink in to this idea of the subdoshas and the dhatus, the tissues. But ojas is often considered an 8th tissue, and I'd agree with that. It's the subtle essence of kapha, or water, in the body, and more specifically, it's the essence of reproductive tissue. Thus, it's the final product of nutrition and digestion, as well as the body's main energy reserve. So that's why I always say with ojas that ojas is the body's ability to withstand stress in the body. So if you've got a client that's like, well, what is this idea of ojas? Ojas is the body's ability to withstand stress in the body, and it's the main body reserve of energy. And though it has no physical structure, it still plays a really important role in our overall functioning, because if our ojas is low, our tejas is high, our prana is low, like it will learn how to look at someone and say, okay, what is the level of ojas? What is the level of tejas? And what is the level of prana? And those are the subtle energies in the body that allow us to understand how to regulate energy, and withstand stress in the body. So we either need to increase prana, increase tejas, decrease tejas. We always want to increase ojas. Can't have enough of it. So, well, you can, but but it's like that. It becomes something that is something else. So this is how we'll end today, is this idea of ojas, and we'll end today with kind of just going over this little little saying of Rasa Rakta Mamsa Medis Asti Maja Shukra. All right. So Rasa Rakta Mamsa Medis Asti Maja Shukra. And then do a flashcard for this. If these things work for you, and everybody learns a little bit differently, but for myself to memorize them, because you will need to know them for your exams. This is a really good way to do it. And then you can kind of go through and say, okay, Rasa is plasma, Rakta is blood, Mamsa is muscle, Medis is fat, Asti is bones, Maja is a nervous system and bone marrow, and Shukra is semen. Like, so you can really start to like know this inside and out, and then start to get into your like idea before, is like you really want to live this. And so start to feel these layers of tissues in your body. Start to feel the idea of like the rasa, the plasma, being juicy and nourished, your rakta and your blood being nourished by that ocean of rasa, so that your blood is fresh and good, and your muscles are getting all the nutrients that they need, and your fat tissue is getting what they need, the asti and your maja and your shukra. So, just start to really think in terms of yourself as this living tissue with these layers that correspond with the universe, right? So that's what they're saying. Basically saying that, that these 7 layers of tissues, or 8 if you want to include ojas, also parallels with the universe as a whole, which also has 7 planes of existence, which we'll look at. And also has 7 koshas, and also has 7 chakras. So it's all connected, and we're just at this very beginning stage of learning this, and I think we should probably close there, and we'll pick up next week, going through each one of these tissues in detail. Any questions? No. We'll have some case studies next week, so it'll be a little bit more interactive. I just wanted to get through this content so that you really understand it. And I highly recommend memorizing it, so that you've got like this idea of when you hear asti, that asti means bones. When you hear rakta, that it means blood, and just learn it so that you've got that muscle memory. And as we move forward, it's second nature, because it will be. It will become second nature. Thank you, guys. I'll end with Om Shanti, Shanti, Shanti. Peace, peace, peace. And if you have any questions, please feel free to email me, or put it on Facebook as well. And I'll stay afterwards if anybody needs anything individually. So just grounding your feet, feeling your contact points of your body to your chair. Taking a deep inhale and exhale. Inhaling. Om Shanti, Shanti, Shanti. Thank you, guys. Have a wonderful rest of your week.
Thank you so much.
You're so welcome.
Yeah, I've actually shot a couple of messages off. A friend's got a health food shop and another friend's a naturopath that works in a health food shop to see if they
Yeah.
have that product. So
Yeah.
I'll now jump on and Google Newcastle, and wherever I can find it, I'll get in the car and go get it. So
You can get it on iHerb as well. I like
heard,
iHerb, yeah. It just takes
I
a little
did
while.
see that. Yeah, and I kind of want it now, but that's me
Yeah.
being impatient.
Yeah, yeah.
Great. Thank you so much. Have a
You're
beautiful day.
welcome. Bye.
Thanks. Bye-bye.
Hi, Jasmine.
Hi.
Hey, can I ask a really quick question?